I remember May 10th, 2012, Mother's Day, very well because I woke up shaky and scared. My speech was slurred and I felt uneasy. I knew I needed help. We called 911. My roommate was Mexican and couldn't speak enough English to explain my condition to the operator. I tried to tell her what was happening, but she kept making me repeat a silly riddle instead of sending me help. 4 days later, I came home to the Pueblo of Pojoaque, and my daughters became my caretakers, day and night for about a month and a half. They did it themselves with no help and no training, just simply out of love. 3 months later, I had a reoccurring episode. We were unable to find assistance for caregiver support. Eventually, I went to a local program to seek assistance. I spoke with the home care director and was denied because I was still employed part-time. My condition was chronic and unpredictable and caused me to retire. I went a second time to find caregiver assistance to help me shop for groceries, clean house, pay bills, and do all those things I normally did alone. Finally, I was approved. It took 3 months. Next, I was required to get a letter from my doctor stating the health reasons for the caregiving service, and I also had to get a background check for my caregiver. I was only eligible for 100 hours of service over a 6-month period. To this day, I do not believe the director of the program was convinced I deserved this service. I felt so disrespected as an elderly person seeking health services because 1, I was being denied services because I worked part-time, and 2, because professional healthcare workers did not show compassion for a person in need and weren't as knowledgeable as they should have been about their services and programs. Disqualifying me because of a part-time income is absurd. What and who qualifies a person to get services? Our Native elder population is growing and we have more medical needs and more mental health issues. Because there are so many healthcare needs, a caretaker can become more overwhelmed. Caretakers and the Native elders they care for need to be protected because they depend on each other to be healthy. Many of our family members do it simply out of love. I would like to see in our community an adult daycare program or an elder care facility that can help family caretakers receive respite support. Many of our community members believe that we should take care of our own elders, but caretakers need help too. They need time to take a break and visit the doctor for their own self-care. They need time to attend to their own personal and family needs too. In August 2012, I was diagnosed with somatic symptom disorder. It is related to post-traumatic stress, which usually comes from a past traumatic experience and is commonly found among women. My desire is to bring awareness to these issues so that other elders won't be denied services and become frustrated, embarrassed, or depressed. We need to understand the complexity of health and health care in the United States today. As for me, I am trying to return to the active person I once was before. I used to love to bowl, dance, and travel. In order to keep myself alert and productive, I have returned to jewelry making. I was 20 years old when I was first introduced to it in an adult education program. I have made jewelry for over 44 years and I plan to continue to do so. It makes me feel creative and happy and it helps me to forget my health challenges. Since my grandson was born, I've also been teaching him our native Tewa language. He is 2 years old now and understands everything I tell him, which makes his mom a little jealous. I do it simply out of love.